The information provided in this essay is intended for general knowledge and understanding only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your doctor or other qualified health professional with any questions you may have regarding a medical condition. Our kidneys are incredible organs. They work tirelessly, filtering waste products from our blood and maintaining the delicate balance of fluids and electrolytes in our bodies. But when kidneys fail, our lives are at risk. That's where dialysis comes in, a life-saving treatment that steps in to perform the vital functions our kidneys can no longer handle. Dialysis becomes necessary when kidneys can no longer filter waste and excess fluid from the blood effectively. This can happen suddenly, due to acute kidney injury, or gradually, as a result of chronic kidney disease. Without dialysis, toxins build up in the bloodstream, leading to serious health complications and eventually, death. Dialysis acts as an artificial kidney, removing waste products, excess fluids, and salt from the blood, allowing individuals with kidney failure to live longer, healthier lives. It's a lifeline, offering hope and a chance for a better quality of life despite the challenges of kidney disease. Imagine dialysis as a sophisticated filtering system. It takes over the critical role of the kidneys, ensuring that waste products don't accumulate to dangerous levels. For many, dialysis is a bridge to a kidney transplant, offering a chance for a more permanent solution. There are two main types of dialysis: hemodialysis and peritoneal dialysis. Both methods effectively filter the blood but differ in their approach and the lifestyle adjustments they require. Hemodialysis, the more common type, involves using a special filter called a dialyzer to cleanse the blood outside the body. During treatment, blood is drawn from the patient's bloodstream through a specialized access point, usually in the arm. The blood then circulates through the dialyzer, where waste products and excess fluids are removed. The cleansed blood is then returned to the body. Peritoneal dialysis, on the other hand, utilizes the body's own natural membrane, the peritoneum, as a filter. The peritoneum is a thin, sac-like lining that surrounds the abdominal organs. In this method, a sterile cleansing fluid called dialysate is infused into the peritoneal cavity through a surgically implanted catheter. The dialysate dwells in the peritoneal cavity, allowing waste products and excess fluids to pass from the blood vessels lining the peritoneum into the dialysate. After a set period, the used dialysate is drained and the process is repeated. Each type of dialysis has its advantages and disadvantages. Hemodialysis offers efficient waste removal and is typically performed at a dialysis center 3 times a week. Peritoneal dialysis, while requiring more frequent exchanges at home, offers greater flexibility and allows for more dietary freedom. For hemodialysis to be effective, reliable access to the bloodstream is crucial. The two most common methods for creating this access are the permacath and the AV fistula. A permacath or catheter is a soft, flexible tube inserted into a large vein, typically in the neck, chest, or groin. It provides immediate access for hemodialysis and is often used as a temporary measure while waiting for an AV fistula to mature. Permacaths are relatively easy to place, but they carry a higher risk of infection and clotting compared to AV fistulas. An AV fistula is considered the gold standard for hemodialysis access. It's a surgically created connection between an artery and a vein, usually in the forearm. This connection allows for increased blood flow and strengthens the vein, making it suitable for repeated needle insertions during hemodialysis treatments. AV fistulas, while requiring a minor surgical procedure and several weeks to mature, offer superior longevity, lower infection rates, and improved blood flow compared to permacaths. The choice between a permacath and an AV fistula depends on individual patient factors and the urgency of dialysis initiation. Your healthcare team will carefully evaluate your situation and recommend the most appropriate access method for your needs. The rhythm of dialysis. How often? The frequency of dialysis treatments varies depending on the type of dialysis and the individual patient's needs. Hemodialysis is typically performed 3 times a week, with each session lasting 3 to 5 hours. During a hemodialysis session, patients are connected to the dialysis machine, and their blood is circulated through the dialyzer, where waste products and excess fluids are filtered out. Patients can usually read, watch TV, or even take a nap during treatment. Peritoneal dialysis, on the other hand, can be performed daily or even multiple times a day, depending on the specific method used. Some patients perform continuous ambulatory peritoneal dialysis, or CAPD, which involves manually exchanging the dialysate solution 4 times a day. Others may use an automated system called continuous cycling peritoneal dialysis, or CCPD, where a machine performs the exchanges overnight while the patient sleeps. The frequency and duration of dialysis treatments are carefully determined by your nephrologist or kidney doctor, based on factors such as your residual kidney function, overall health status, and lifestyle. The goal is to provide adequate dialysis to manage symptoms, prevent complications, and maintain the best possible quality of life. When dialysis becomes a necessity. Dialysis becomes necessary when kidneys can no longer perform their essential functions adequately, leading to a buildup of waste products and fluids in the body. This can occur due to a variety of factors, and recognizing the signs of kidney failure is crucial for timely intervention. One of the most common indications for dialysis is end-stage renal disease, or ESRD, a condition characterized by irreversible kidney damage and a glomerular filtration rate, or GFR, of less than 15 milliliters per minute. ESRD can result from chronic kidney diseases such as diabetes, hypertension, glomerulonephritis, and polycystic kidney disease. Acute kidney injury, or AKI, a sudden and often reversible decline in kidney function, may also necessitate dialysis. AKI can be triggered by infections, medications, dehydration, trauma, or obstruction of the urinary tract. Dialysis may be required temporarily to support kidney function while the underlying cause is addressed. Other indications for dialysis include severe electrolyte imbalances, such as hyperkalemia or high potassium levels, or metabolic acidosis, as well as fluid overload that is unresponsive to diuretics. Symptoms of kidney failure that may prompt dialysis initiation include fatigue, shortness of breath, swelling in the legs and ankles, nausea, vomiting, loss of appetite, and changes in urination. Understanding dialysis, a vital treatment. Dialysis stands as a testament to medical innovation, offering a lifeline to individuals living with kidney failure. It is a complex and demanding treatment, requiring significant adjustments to one's lifestyle and daily routine. However, it provides a chance to live a longer, healthier life despite the challenges of kidney disease. Understanding the different types of dialysis, access methods, frequency of treatments, and indications for therapy is essential for patients and their families navigating the complexities of this life-saving treatment. Knowledge empowers informed decision-making, enabling individuals to actively participate in their care and strive for the best possible outcomes. Remember, dialysis is not a cure for kidney failure, but it is a bridge that allows us to live meaningful lives while exploring options such as transplantation. With advances in medical technology and dedicated healthcare professionals, the future for individuals living with kidney disease continues to brighten.